Hello and welcome everyone to the Evergreen webinar for health professionals, learning the holistic approach to ADHD treatment for health professionals. While I pull up my screen here, why doesn't everybody let us know where they're coming from in the chat? Just put in where you're tuning in from or what you had for breakfast this morning. UK, very nice. NYC, Barrie, Ontario. Great. Already got a diverse crowd in the first couple. Okay, can everyone see my screen okay? Great. All right. So, to kick things off, please let us know in the chat what got you to come here. What were you most interested in learning? And my assistant Olivia, who's on the call with us, will answer your questions. And then also we're going to put a Slido in the chat for you all where you can ask any questions you want. We'll go through those at the end. And you can also upvote and downvote on any questions that have been submitted. So if you see a question that someone's already asked and you want to get that question addressed, just upvote it. And then we'll go ahead and pin that at the top so that anybody will be able to see it no matter when they join. And then Olivia, let's keep pasting that throughout the call. Okay. So before we get started, please reduce the distractions around you and stay until the end. There will be surprise offers for everyone who does. 3 quick things. This is going to be interactive and fun. You're going to learn a lot, and there's Q&A at the end. And I'll let you know where you can get more info. Plus, there's a very special offer for those who are on live. So today, how health professionals can make a greater impact on the lives of patients with ADHD. So I'm going to make 3 promises. This is important because if you don't use the right approach, you could seriously harm your patients and put them at a disadvantage. You will unlock a tried and true approach tested by thousands of healthcare professionals and taught from the world-leading experts on how to best care for patients with ADHD at home, school, work, and beyond. And if you don't do this, this is what's going to happen. You may waste thousands of dollars using solutions that don't work. Your practice will suffer from negative reviews, and you won't be able to properly care for your patients. Now, do you want to learn more about ADHD and our approach? So here are a couple statistics about the different struggling caregivers of kids with ADHD. So about 66% or so of parents struggle to help their kids. 99% of teachers struggle to help kids with ADHD, and around 50% of pediatricians also struggle. So this tells us that of all the main caregivers for these kids, most of them are struggling, which is a huge problem. On top of that, ADHD is becoming increasingly important in healthcare. It is one of the most common chronic disorders in primary care settings. And the reason that it's important to learn about ADHD is because 1 in 5 kids have learning and attention issues, which is around 14% of all public school students. It's a national mental health crisis that is growing incredibly quickly. And that means there's a lot of opportunity for innovation. So around 6.4% compounded annual growth rate, with a market that's forecasted to be around $25 billion by 2025. There's been a steady rise in ADHD patients during the last 20 years, according to a study conducted by the National Health Interview Survey. The prevalence of ADHD among children and adolescents in the US rose from 6.1% in 1997/1998 to 10.2% in 2015 to 2016, And that number and percentage has grown significantly since that time. Plus, just one visit to a pediatrician for a complex medical problem like ADHD costs around, on average, $234 for just 40 minutes. And 50% of pediatricians, who are the go-to health resource for affluent parents, fully admit that they're not trained on how to treat ADHD specifically. So tell us again in the chat, why are you here today? You heard about the online help available to people with ADHD and their health professionals, and you're here to learn more about it. You know about some of the struggles of health professionals treating people with ADHD, and you know that you need to do something about it, but you just haven't gotten around to it yet. You started looking into solutions to help your patients, but you're just not getting the results that you want. Or you're an expert in the field of ADHD, but you could always use a few more tips. Or last but not least, you're bored and you're just here to listen in, which is totally fine as well. Okay, so I want to teach everybody a little bit about what this was like for me when I got started in what I call the Facebook group nightmare. So at the time, there was only Facebook groups for support. And these are the kinds of messages that I would see and posts that I would see in them. And the problem with this is there was nothing helpful. And I felt really bad because these are just people who are venting about their troubles and their problems, but they're not having any solutions in these groups. And so you just kind of ended up in this hamster wheel of trying to find solution, trying to ask for help in all these support groups and not finding what you needed. And that all changed when I found the right ADHD experts. So here's a couple of them. You may recognize some of them. They are the biggest names in the field. And that changed everything for me. So after meeting all of them and learning everything that I could about ADHD, I learned more than I ever could have through years of research alone. Now we have a community of over 7,800 caregivers. We have over 70 plus ADHD experts. We have over 150 hours of courses taught by these experts. And today you're going to learn how to correctly target and help with motivation, procrastination, and seeing projects through, the best strategies that solve the homework struggles and improve academic performance, the #1 approach to improving family and interpersonal relationships starting today, the most effective way to tackle comorbidities like anxiety, depression, rejection sensitivity dysphoria, SPD, ODD, etc., the truth about medications and what to do about it to become the best ADHD health professional, tested by thousands of healthcare professionals and taught from the world-leading experts. My #1 recommendation for all healthcare professionals, support tactics other than the generic stuff to save you thousands of dollars using solutions that don't work and years of time using practices that suffer from negative reviews. And my goal today is to teach you my best information about how to thrive as a health professional treating ADHD so you can make smart decisions as you move forward. But first, let's start with some myths. So, ADHD caregiving myth #1, you have to be a natural-born health professional. So this is busted. And the reason I can show you that is because here's my background. My name is Adrian Harrison. I'm the founder of smartcourse.io. I was a serial entrepreneur specialized in education and health technology. I was featured in Forbes and Health Venture and StartEd's EdTech Accelerator and many more. I've spoken at WeWork, Health Venture, StartEd, Founders Boost, and many more. I'm a marginalized student, and all my best friends were due to ADHD symptoms. And my mission is to empower parents, educators, health professionals, and kids throughout their lives. Why? Because I want to make sure that all individuals with ADHD get access to equal opportunity, education, and a chance to thrive. So starting out, I had no experience with this. #2, you have to know all the right people already. Again, I had 0 connections to start out with. So this myth is busted. This is me in September 2019, doing my first video on ADHD, having spoken to one expert at the time. This is me in March 2021 with a panel of 5 experts, having already run multiple summits with 60 plus, right? So that only took 2 years. And that is an accelerated trajectory to run multiple summits. This is me in September of 2022, again, with another live expert panel. And it just goes to show you don't need to know anybody when you're starting out. If you have just the drive and the willingness to learn, you can accomplish it. Here I am interviewing Edward Hollowell, the foremost expert in the space of ADHD. And this is Ross Green, another leading expert in the field. And here's another one with Stephen Hinshaw, prolific expert and academic in the field. And Sam Goldstein, literally the godfather of ADHD, who basically popularized how to diagnose it. So, last myth, you need tons of time and money to succeed. Busted. Again, when I started out, I had 3 things that I wanted to do to make this possible for everybody. Decrease the cost of access to expertise, democratize information, and concretize our ability to learn quickly and effectively using online resources. To summarize, this is where we're at as a result of that approach, with over 700,000 people helped, a 95% improvement on average in mental health symptoms, less than 6 months to see transformational results, and $10,000 to $20,000 per year saved per customer. So you don't need that much time and you don't need that much money up front. This is possible today thanks to the technology that we have and the ability to use experts' information in a distributed way for cheap. Okay, so a couple more things that we're going to learn today. These are some of the problems that you might be facing as a health professional. Let us know in the chat if these are things that you can relate to. Managing executive function deficits and motivation, organization, and time management issues for your patients. Deteriorating family relationships, lack of communication and social skills in your patients. Empowering your patients through stress, anxiety, and other comorbidities. Understanding the best ADHD strategies, treatments, and methods as a health professional to treat your patients. Struggling with the right accommodations and recommendations to succeed in your practice. And being able to treat patients' unique needs as effectively as possible. So let me tell you a little bit about the ADHD Summit. So the ADHD Summit is a resource that I put together when I was trying to learn about all this for myself and my friends. And I realized that if there are all these experts out there that have this information, and they're charging sometimes upwards of $1,000 for an hour of their time, why can't we just package all of their information into a structured curriculum that makes sense, solves all of the problems, right? Not just the ones that they as an individual could solve, and that anybody anywhere with an internet connection could access. And so that's exactly what we did here. And we also made it incredibly easy for any individual who's struggling with any kind of symptom to let us know what they're struggling with and customize what information we would recommend to them in a customized ADHD action plan based on those symptoms, based on their learning styles, based on their budget, based on any factor that you would consider as somebody trying to solve this problem. Okay, here's a couple big logos for y'all just to get a sense of who our partners are and how we got to this place, right? The National Center for Learning Disabilities, got featured in Forbes. We worked with Chad, Attitude Magazine, the Clay Center for Young Healthy Minds, the American Psychiatric Association, the Mayo Clinic, the Child Mind Institute, which is in here, that's there too. You may be familiar with Impact ADHD or understood.org. So these are all people that we've worked together and realized that there's a problem as well and worked towards fixing it. We got some praise from some experts in the space. This is Elaine Taylor-Klaus from Impact ADHD. And you can check out all of these testimonials on our website, which is smartcourse.io. Right? Leslie Josell, who's the principal of Order Out of Chaos, speaker, coach, and creator of the award-winning Academic Planner, A Tool for Time Management. Stacy McCoy Prime, an educational consultant and formal school leader. Dr. Conchetta Decaria, an esteemed neuropsychologist and diagnostician. Mr. Daniel Komarski, a teacher and administrator for over 30 years and parent with ADHD, 2 twin daughters, both with ADHD. And so we've broken this down into 3 main plans. We'll come back to these to show you exactly how all of this comes together. But in a nutshell, we realize that you need perks and deals from experts, right? So that you can afford the kinds of content that they're putting out. You need an expert moderated peer support group, right? Not just a peer support group filled with people who are venting, which is totally fine, but not very helpful. Access to live masterclasses so that you can ask your own questions to these experts at a fraction of the cost that it would take if you wanted to take a one-on-one consultation with them. Right, a library of all these masterclasses and resources, action guides so that you don't have to spend hours and hours going through everything. If you don't want to, you can just go through the action guide and take the steps that are necessary. An online course library that dives deeper into the specific pitfalls that everybody who's struggling with ADHD goes through in much more detail. So like how to get a diagnosis, or how to set up accommodations at school, or how do you solve the medication problem. All of these things. Audio lessons so you can listen on the go. It's very effective if you're in the car or on a commute. A care coordinator, which helps you pick out what resources you need based on your unique situation. And our ADHD professional matching service, which matches you with the different health professionals that you would need, right? So everyone listening here, you'd want to be listed on this network so that parents who are also in our network and are looking for help from health professionals can find you, right? So I'd encourage everybody to check that out. Okay, so why are digital resources becoming so important for ADHD? Here's a Google Trends line for the search term ADHD. So as you can see, there's a very positive trajectory and it's been going up ever since, right? This is over the last 4 years. So it's growing. I've interviewed hundreds of health professionals that are struggling with ADHD. Here are some of the things that I've heard. I struggle with parents not listening to my recommendations. Again, let us know in the chat if these are things that you can relate to. I want to make the best possible treatment plan that addresses her comorbidities. Organization, paperwork, and recommendations between administration, parents, and therapists is a nightmare. I want to recommend the best strategies for my patients so they can take ownership of their ADHD and succeed. Things aren't great at home for my patients. I need the best methods to help the family as a whole. None of the strategies I suggest will work unless parents and teachers get on board too. Ryan's parents definitely had major fears about him succeeding in life. They have a lot of anxiety about school, social life, and his future, and I need to communicate more effectively with them. So let us know, does any of these sound familiar? The exciting piece about this is you are all pioneers at the forefront of access to the best resources on ADHD because of how much this space is growing and how quickly it's growing. So once I started learning directly from these experts on ADHD, I didn't have to spend hours second guessing my decision or sifting through misinformation or fearing that I regret my decisions. I would just implement the strategies and instantly get positive results that dramatically improve my life and the lives of the people that I cared most about. So I'm going to dive into some of these takeaways now so that you can all see the kind of information that we're sharing. So this was our masterclass with Dr. William Bill Dotson. If you don't know him, he's an incredibly successful psychiatrist for specifically ADHD and one of the foremost experts on it who really pioneered in that field. And so with his masterclass, Medications, Alternative Treatments, and the ADHD Brain, we covered medications, how to decide whether to medicate and how to do it best. So when parents say medication isn't natural, a good answer to that is medication is more natural than allowing your child to suffer unnecessarily. And the reason this is important, and I'm sure there's a lot of controversy around that, is because many, many, many studies, including those of the Child Mind Institute, et cetera, have shown that in 80% of cases, a simple psychostimulant medication can solve all of the symptoms of ADHD in 80% of cases. In all cases, the most effective approach tends to be medications with behavioral therapies. And that combined approach has shown to be the most effective. So explain to your child how to use medications is like trying a new strategy, right? So when you're in a consultation with those parents, it shouldn't be a daunting thing like, oh, it's very scary and there's all these possible side effects, et cetera. No, it's just a new strategy that you can test. And if it doesn't work, you can change it, or you can always go back. It's not a one-way street. You want to look for a clinician who loves kids, right? Especially those with ADHD, because as we just saw, about 50% of pediatricians fully admit to not knowing how to treat kids with ADHD. A lot of medical professionals still don't think ADHD is real. So that's another thing to look out for and make sure that you're showing your clients and your parents. And then two main types of medications that are used for ADHD, for those of you not aware: stimulants, which are performance enhancements, and alpha agonists, which lowers hyperarousal and rejection sensitivity. So these are just, 5 bullet points that we took away from this masterclass. There's way more information. It's about an hour and a half long. Here's another one from the category of the tougher side of ADHD and comorbidities and how to cope with them. This is from Dr. Jerome Schultz, who was at Harvard Medical School. And his masterclass was middle school ADHD and stress, what to know and what to do. So here's his Destress Model that he shared to help both the adult and child figure out what's going on and how to manage it. D is for define, understanding the condition. E is for educate, teach the child about the impact. Speculate, looking ahead for positives and negatives. Teach, strategies that maximize success. Reduce the threat, exercise physical activity and reduces stress. Success replaces doubt with confidence. And strategize, use what you learn to plan ahead. Here's another one from Dr. Sarah Wayland. And this is for treatment as a team effort. Probably one of the most important takeaways from all of my work is understanding that treating people with ADHD, especially kids, is a team effort, and that you're all part of the treatment team. The importance of parents, doctors, and educators working in harmony. Use the STEP method to engage everyone in the support team. S for say what the problem is and get everyone's perspective. This is really important because ADHD presents itself differently in different settings. So even though the symptoms may be presenting as hyperactive and impulsive in a home setting, they could be presenting as inattentive in a school setting. And unless the educator and the parent are on the same page about that, you're going to be having discussions and fights about what the best solution is moving forward. So it's really important that everybody has a clear picture of what everybody else's perspective is on the individual. T is for think about possible solutions to the problem. No judgment allowed, right? A lot of times we see parents and educators fighting during parent-teacher meetings when they really should be collaborating, because they both have a very important role to play in these kids' lives. Same for health professionals, right? Evaluate possible solutions among the team. Communicate why you believe in your solution and give reasons. So this is really important for health professionals because we need to rely heavily on data here, right? When you have an actual diagnosis, formal diagnosis of ADHD, and you do that battery of tests, and you have hard data to show the school or to show the parents, that is what helps them get accommodations in place for those kids, right? It's the same thing that you can share to adult patients so that they can get accommodations in their workplace, right? Which is going to help them massively in their lives. P is for pick the best solution. The rule, each person has to think the solution is at least reasonable. This is important because everybody needs to buy in. If there isn't ownership, right? If people don't feel like they've bought into that solution, you're going to have conflict, and some people aren't going to follow through. And if people aren't following through, then you're going to have struggles with progress. S is for see how it works. Implement the solution and meet in 2 weeks to evaluate the results, right? So this step method is, in a nutshell, how you should approach working with people with ADHD and the people that care for them. Okay, alternative treatments in social learning with Dr. Anna Vagan. So her masterclass was called Play to Practice, Gaming for Social Learning. And it demonstrated how gaming can be an engaging way for children to build their social skills. Card games, tabletop games, competitive games, role-playing games, learning games, dice games, etc. The skills learned are how to practice sustained engagement in an activity, understand that mistakes are okay, accept rules to meet a goal, gain a larger perspective, control impulsivity, read verbal and nonverbal cues, demonstrate flexibility, among many other skills. Right? So this is a very fun way. Of course, it's more towards kids, but can absolutely apply to adults as well, to use a fun and engaging medium to teach really important skills that kids with ADHD struggle with. Navigating relationships for ADHD and non-ADHD partners, probably one of the most requested topics we get, taught by Melissa Orlov, who's the foremost leader on how ADHD affects relationships. So her masterclass was ADHD and Relationships, how ADHD affects relationships and how you can help. ADHD and non-ADHD partnerships can have unique challenges. You are different, but your needs are similar. Be on the same team. Once weekly, set aside a time to talk about how you contribute to each other. You can thrive with ADHD. ADHD does not need to interfere with having a happy relationship. Process conflicts openly and without hostility and defensiveness. Equal status is critically important. For your ADHD partners, treat them with understanding and empathy and thoughtful, respectful interaction. And for non-ADHD partners, give attention, support, and calm respect. And for both sides, appreciate each other, right? And something that we've seen again and again is how having ADHD and being open about that changes people's perception of you. So keeping this in mind and understanding that, being vulnerable and sharing that information, whether it's with your partner, with your boss, with your teachers, with whoever is going to be taking care of you or judging your work, is a vulnerable spot. And so these lessons and many more that she shares, not only in her masterclass, but also an online course that we did together, give you the step-by-step scripts and the processes on how to implement these kinds of changes. Practicing mindfulness for stress relief and regulation. This is with Dr. Christopher Willard, also from Harvard Medical School. His masterclass was Growing Up Mindful, Mindfulness and ADHD. We've seen such major links between mindfulness and ADHD. It's probably the most effective non-medical intervention. So mindfulness is just paying attention to the here and now with acceptance and non-judgment. Okay, there's a lot of different interpretations of this. In this way, we're just saying, we're just defining it this way. Stress overloads the brain and worsens attention issues. So being able to modulate that stress and de-stress effectively through mindfulness practices of any sort, doesn't have to be meditation, it could be anything, is very important. It starts with you. Be aware of your own self-regulation, and mindful activities can include 7-11, which is breathe in for 7 seconds, breathe out for 11 seconds, take a deep relieving sigh, stretch hands behind your back, and many others. Breathing, especially diaphragmatic breathing, where you're breathing into your belly and relaxing those muscles around your diaphragm, has been shown in many studies to de-stress and calm people down. Okay, managing rejection sensitivity dysphoria for ADHD. For those of you who don't know, rejection sensitivity dysphoria is a very common comorbidity for people with ADHD. This was taught by Jody Klugman-Robb in her masterclass, The Highly Sensitive Person, What to Do with Rejection Sensitivity Dysphoria. When you feel heightened or frustrated, remind yourself that you are dealing with a brain structure that is out of your/their control. Patience is key. Plan ahead. The best way to deal with problems that you know are coming is to have a plan of action for when they do. What self-soothing tool can you use when a situation arises? That could be different for anyone, right? Some people have fidget spinners, some people have stress balls, some people have a mindfulness practice. But whatever it is, maybe you go for a walk, maybe you take a bath, maybe you do some sports, have a plan in place so that you know, okay, this is the time to enact that and get the results that you're looking for. If you need a minute, take it. Take a moment to regulate. Use self-soothing skills of your own so that you can help you or the child do the same. Because they all learn by example. So that was just a very brief example to show and illustrate the point that you just learned some invaluable lessons on a webinar, right? In 15 minutes. How would you like to learn directly from over 70 world-class ADHD experts and specialized instructors? So here's our special offer for you today. World-class ADHD experts and instructors, over 70, that will be available to teach you everything you need to know as a health professional to tackle everything about ADHD across the lifespan. So literally from 0 till you can become successfully independent as an adult. We cover all of it. So the ADHD Summit is by far the #1 most comprehensive resource to teach you and help you thrive with your patients. So I'm going to break down each of these, right, as we did earlier, but in more detail. So you get a personalized, dedicated care coordinator, right? That's about a $500 perceived value, where you can ask any question you want. Anytime you have a struggle, you know exactly what to look for, you know exactly what resource to use, and you have somebody holding your hand throughout the process. We know that this can be an extremely challenging and difficult struggle, especially for single parents. So this is especially helpful to people who want to know that there's going to be someone who's there helping you out throughout the entire process. Our ADHD professional matching service, where you can get matched with parents who are looking for your help, right? One of the biggest issues we've heard from health professionals is that they don't do their own marketing, or they don't know how to get their word about their business out there, or how to grow their practice. And this nullifies all of that. You don't need to know how to do that if you're on this matching service, because there are tons of parents who are already looking for help, and they've already told us exactly what they're looking for. So if you meet those criteria, you get matched with them. Whoops, skip the slide. Okay, also you get monthly live masterclasses and sessions, plus live Q&A panels like the ones that we went over earlier with ADHD leaders and experts, right? So this gives you that opportunity to ask whatever you want. You don't have to pay $1,000 to see this person one-on-one. You can just join the live masterclass and ask them whatever questions you have. 70 plus video masterclasses, right? We have over 150 hours of content from all of these experts, and each masterclass targets a very specific pain point that we know people with ADHD struggle with, or caregivers of kids with ADHD struggle with. And so by watching them, you're going to know exactly how to solve that problem and how to bring that solution into your own practice to help the people that you care for. 6 in-depth online courses. Daniel Kramarski covering the middle school years, Dr. Conchetta DeCaria covering how to get an ADHD diagnosis, Melissa Orlov on how ADHD impacts relationships, Dr. Sarah Allen on the ADHD brain and accommodations, Dr. Sarah Wheeler on school psychology, and Dr. Sharon Celine on ADHD and anxiety as a comorbidity. Action guides, session notes, and handouts. Again, these are resources that we've put together ourselves for every single masterclass, and resources that all of our experts have created for you to go with those masterclasses as handouts. So you get slides, or you get worksheets that they've put together, or notes that help you through this content, so that if you don't want to, you don't have to watch the whole masterclass. You can just take action in 5 minutes. Because we realized when you're counseling people, or if you're in a grocery store and your child has a tantrum, you don't want to go through a masterclass for an hour. You just want an answer to the problem that you're experiencing in that moment. And so that's what these do. Audio lessons of everything, all the masterclasses and online courses, so you can listen anywhere on the go. Access to our expert moderated peer support group, where we have many of the experts that we've had done masterclasses in the group, so that you know there's not going to be any misinformation. You know that everybody in that group cares just as much as you about making that group valuable to everybody and keeping the information useful. And then perks and deals from all of our partners. So that includes an ADHD expert workshop and live Q&A, where you can learn calmness and connectivity with Cindy Goldrich, a parenting workshop with Andrea Elrome, ADHD marriage workshop with Melissa Orlov, a live Q&A with Dr. Anna Vagan, a live Q&A with Mr. Daniel Kramarski. You get the parent manual, which is step-by-step instructions to become a calm and confident parent while raising kids with complexities. And although this may not seem as relevant to health professionals, I can tell you from experience and from some of the health professionals that have used it, that this is one of their most valued resources as well, because it shows them the perspective that parents are going through, and that helps them help parents. Sanity School for Parents, which is training designed to radically improve the lives of parents dealing with children with ADHD and related challenges. 6 super skills for parenting to build executive functioning. Learn how to help your child develop organization skills, attention skills, planning skills, mood management skills, and more. Again, this is not just for parents. Home study webinar, what your child with ADHD wishes you knew and how you can help. One of the biggest pain points we've seen is homework. Maybe some of you have heard that as well. So that is incredibly helpful for that. And then, so all of this together, you're getting a total value of over $9,000. You're saving, if you join today, 95% off the full value price. Okay, so this is a summary of everything that you get through the ADHD Summit. Here we go, personalized care coordinator, ADHD professional matching service, access to live monthly masterclasses, lifetime access to the expert masterclasses and online courses, 150 plus hours of masterclasses and walkthroughs, 70 plus session notes, handouts, and action guides, exclusive lifetime access to our expert moderated peer support group with peers and instructors, and special deals and discounts from our partners, and more. So anything you can think of, it's all included. And the best part is, we're so confident that you'll value everything that the ADHD Summit personalized care plan gives you, that we're willing to offer you an outrageous 14-day free trial, no credit card required. That means you can access everything for free with immediate access right now. There's zero risk. So in the next 15 minutes, I'm going to put out a special discount code and the link, right? If you use code ADHD webinar at the link that we're going to send in the chat right now, you can join for 25% off on your first bill, right? But again, like I said, there's a free trial for 14 days for free. So I'm going to put that in, and then I'm going to move into Q&A. All right, so I put the link in the chat. If you go there and you sign up or enroll now, you should see a little pop-up. And if you're ready to join and you want to join now, you're free to do that. And you can use ADHD webinar to do that for 25% off in the next 15 minutes. And if not, you can just start your free trial and you'll have 14 days to check out everything for yourself and see if it's worth it. And we'd love to hear your feedback. Okay, I'm going to navigate to the Slido. So somebody asked if we will send a copy of the PowerPoint. You can get the recording of this webinar if you join the personalized care plan or the guided care plan. So if you go to that link that I sent in the chat and you sign up, you'll have access to all of these recordings. Okay, so here we have another question. I want to grow my business. Do you have any tips as an entrepreneur? Yes, absolutely. And actually, we have a growth consulting service specifically for health professionals to grow their business, because we've done it at SmartCourse and we want to help other health professionals grow their business to increase their impact. So if you're interested in that, I'll put the link in the chat for our growth consulting service, and you can sign up for a free consultation. Okay, that link is in the chat. All right, next question. How do you choose your experts? Great question. So years of research, right? Which you don't have to go through, thankfully, but looking at the scientific articles for what solutions to ADHD have come about, what is the best peer-respected solution from a health professional's perspective, looking at other conferences to see which speakers have done incredibly well, right? And asking the conference organizers who they'd recommend. And obviously having all the content from experts vetted by our experts and advisors. So we have a comment here, not listening to recommendations is tough. Yes, it definitely is. And that's why having the treatment team work collaboratively is really, really important here. You don't want to be combative. You don't want to be prescriptive. You really want to be listening empathetically to your patients as much as possible and understand where they're seeing it. Because you have to understand, they're seeing a completely different world also because of the internet. There's so much misinformation out there that it's very easy for them to think this is the way to do it, even though they have no scientific backing for that claim, or it's just a feeling in their gut, but that's how they feel. And unless you can empathize with that and understand how it came to be, you're going to have a really hard time convincing them that you know the best solution. And that's another reason why we have so many different experts, because Some people, no matter what, will not take medication. Even if it's proven, even if there's the data to back it up, that's just their values. And I respect that. So we have other master classes that cover alternative treatments, right? Behavioral therapies, ways that you can help kids with ADHD without medication. And so having that diversity of thought and knowledge gives you the tools so that you can navigate around whatever situation your patient finds themselves in and find a solution that works for them. And that's our job as health professionals. Do we have classes on burnout? Yes, we have classes on burnout, on depression, stress. All of these things are interrelated. Dr. Roberto Olivardia is his name, also at Harvard Medical School on depression, and then also Dr. Michael Meinzer, who's at, I think, U Chicago. So check those out when you sign up. Will we get access to the presentation afterward? We covered that. So if you sign up for the personalized or guided care plan, you will get access to all these recordings. How often do you add to the summit? Every month we add. So we have a live masterclass pretty much every month. And each of those masterclasses gets recorded and added to the summit. I was trying to see the pricing to see if I could afford it. Also, the professional growth service is included in this current offer, right? No. So the ADHD Summit is separate from the growth consulting, but you can do both. So the ADHD Summit is particularly for all of those resources that I mentioned that will help health professionals help people with ADHD. The growth consulting services are how to grow your business as a health professional. So that includes everything to do with website design, branding, digital marketing, sales optimization, conversion rate optimization, finding the key metrics or KPIs that you should be tracking as an entrepreneur or founder or business owner to make sure that your business is growing in the right direction. All of that's included in there. Okay. I know that we probably still have more questions, but we do have to wrap up in 4 minutes here. So I just want to give the floor to anyone in the chat if there's anything to close out. And if not, there's still around 7 minutes and 20 seconds. So let's just call it 8 minutes to take advantage of the ADHD webinar, 25% off if you're interested. And yeah, we'd love to see you in the program. We know that it's very helpful. You can check out all the testimonials from everybody who's worked with it before and see the results that they got. And same goes for the growth consulting. We have some case studies on that. So if you sign up, you can let us know if you want to see those. And yeah, I want to thank you all for taking the time. It's really important for everybody in this space to be learning about how to best tackle these problems because, like I said, it's a growing space and the problem is growing more and more. So we really need people that are informed and care about solving this problem. And you being here says that. So thank you. Thank you for doing that. Thank you for your time. And I hope to see you in the program. All the very best.